it's either an exciting topic or a boring topic. We have to decide. But I think it's an exciting topic because it obviously it's a response to many things in Parkinson. And when I say boring, might be it's something we keep hearing about, right? So it's hopefully we can give a nice different message and look at it. So we do want to start off by maybe I was being unfair to the topic when I say boring, but it's just a question that I know that people talk and hear a lot. Maybe the therapist saying, and not only exercise, exercise, exercise. I've actually had someone tell me how much they hate that because they feel very pressured. So I think it's a topic that we must be a little bit more original in our questions. Our question today is actually a way for us to introduce the program that we want to develop for you throughout this whole year. And for us to understand why we go a certain road, we have to identify the needs. So when we think about the world of exercise, I start off by giving you a wonderful, I'd say a wonderful solution that we have. We have all these problems that the complexity of Parkinson obviously is highlighted. I'm sure many of you have seen slides like this before. It just organizes the symptoms that people might go through. Doesn't mean you're going to go through everything. Okay, this is an important message. But now I'm going to highlight each one of them, that each symptom that has at least one research paper to support its the benefits of exercise. So I want you to see how yellow it's going to get. Isn't it amazing? So that means that the reason why people are talking a lot about exercise is because we are seeing the potential of its use to benefit a whole variety of symptoms in Parkinson, which means now we have to be able to focus on how do we get this to people in the best way. And when we think about where can people access exercise? So most commonly, people will have access to exercise through their rehabilitation team. So either physiotherapist, occupational therapist, as I said as well, speech therapist in terms of exercise for your voice. And they also can do exercise in the community. Now, this was one of the comments that came from our questionnaire where someone said, once a month, I work with a physical therapist on core conditioning and balance exercises. So if we make our calculations, this is 12 sessions per year, right? Because as a nice graphic that Sarah Rigard has shared with the world, because everyone tends to use it, it really represents well how the person might spend 1 hour with a neurologist throughout the year, maybe 6 and 6 months you see a neurologist. You might have those 12 or 15 sessions with your physiotherapist maybe, but the rest of the time, we have to really recognize that people really depend on local community resources. And that's why the world of exercise now is based on this community-based exercise. And when we think about these programs, so we can think about many. These are just 3 examples. So what you have here, you have like the Dance for PD program, very, very well known, and all sorts of dance, of course. We have hydrotherapy, we have hydrogymnastics or aquatic fitness, and then Tai Chi. And when we think about these programs, there's lots more. We think about how they've been already, we can recognize the clinical benefits. So as I said, we have been growing evidence and people invest a lot now in terms of research to be able to prove the efficacy of these type of interventions. We also think about it is a brilliant way for us to be able to motivate people to do ongoing exercise. Because we know by research that if you do a program and then we stop the program, we will lose the benefits. Eventually, you'll lose the benefits. So we can't only do programs like 4 weeks and then I'm not going to do exercise. Unfortunately, the research studies are usually like that. Protocols where you have like 1 month, 4 times a week, and then you stop. And then maybe 3 months after, they assess you again. So just to highlight that maybe what's coming out in the research is still far from giving us the right answers in terms what do I have to do to be able to take, I don't know, a month's holiday. We think that one of the greatest advantages of these programs is that it's close to the person's home. And this is very important because we know we're dealing with the disease with certain complexity. There could be very good days and bad days. And unfortunately, we do know there's a progression involved. And so the closer the response the person has to their home, the community that you create is closer to you. And so the longer the person will be involved in that community. So I think this is a key element for care. How can we give very local responses to everyone? One of the most highlighted topics, I think, of 2024, these last few years, has been the socialization aspect and how relevant that is of people, the impact it might even have on cognition. So this is also a nice ingredient that is important in these programs that we get from these programs. Now, those were the benefits that I was highlighting. And now let's think about what are the questions that we still have that we need to answer. And because there's lots of exercise programs at this moment, and the key questions is really regarding the true benefits, which means we always say in research, further research is needed, right? So it's in different types of studies, because we do start out by doing what we call a pilot study, just understanding if people will like to do it, if they're satisfied, if they are safe. But then we really need to prove in larger groups that what type of people will benefit most. So we have different things coming up. We have like the boxing that became very popular very quickly. We have the climbing now, most recently, I think, modality of exercise that exploded. And then we have to have all these options for people, which brings us to 4 different areas that I would highlight where we might need to be focusing our attention and helping progress this area. So if we think about in the research section that I've touched upon, it's really the high level, more strict, or I'd say more relevant type of studies that we still need for most of the modalities of exercise and safety issues. And then also what usually we research in, we have a very selective group of people when we do research that go through a rigorous process of inclusion, which most of the time when we do work with people with Parkinson, we will see that those are not actually the people that we are working with. So sometimes it does not really represent truly the type of people that we're working with, and it makes it harder for us to transfer that research. Okay, but I want to give you just a glimpse of, instead of focusing only on the negative, is show you how much the research has grown. So this is an example of something that really changed practice in 2004, which was the European Physiotherapy Guidelines. And I'm highlighting this one because it was about 22 countries that came together, sat down on a table and tried to decide, collected all the evidence that we had at that time regarding 4 key areas, which was gait, balance, transfers, and falls. And we tried to organize that knowledge into guidelines so that if anyone started working in Parkinson, they would know what was the best evidence for gait, what should they be doing with people with Parkinson to improve their gait. This was one of the first attempts. There were others before, just to say that this was one initiative that was more of magnitude. Later on, so this was in 2020, we actually did an update an attempt of that guideline. You can imagine the amount of evidence that comes out every single day. So it is complex research to put together. But in this one, we were actually quite surprised because the things that were growing most was actually these community programs that we were talking about. So dance, in martial arts, we'll have like karate, we'll have like boxing, exert gaming, like the Wii, the hydrotherapy, and the Nordic walking. Even though you see few studies there, these were the ones that were growing in terms of popularity and research. So interesting transition that we had there. And then we start thinking about, okay, there was research to say that that boxing had lots of benefits. Everyone loves boxing or loved boxing, very popular. But it seemed when it was compared to conventional physiotherapy, the balance outcomes were not that strong. So that means that physiotherapy was still stronger for improving balance versus the boxing. And at that time, we took it upon ourselves to create this study here, which, okay, so, how can I add in elements of balance into the boxing? And we called it boxing with kicking and without kicking, which you could say kickboxing, but okay. This is how we try to clarify the research. And what was our aim here is like, okay, can I grab onto something that is really popular, that people really enjoy, and just add in another element so that we can make it even more efficacious for results. And then when we compared the two groups, so it was about 15 people in each group, and when we compared our main outcome, which was balance, funny enough, we had a response which was there was no difference between the two groups. This was part of my PhD work. And it was at the same time we were quite disappointed because we did, we really wanted to get element, but it was also a learning point that when we do compare different types of exercises, a lot of things have to be put into place. First of all, the type of research, it could be questioned. But comparing both, it's like, was it intense enough? What exactly was applied? Why? Even if we don't show the difference, we showed something very important, which was comparing the both groups. There's what we call patient outcomes. So how people perceive the benefit of these exercises. And that was quite positive. So yes, people perceived improvements in balance. They were motivated and they would recommend it to other people with Parkinson. And these are like key outcomes that can be assessed and should be used by any intervention. I'll say if we are applying exercise in the community, a message for the health professionals, these are very simple things for us to gather so that we can monitor if what we are doing is really benefiting people. And I'm happy with these results, right? I'm happy people are perceiving benefits. But I wanted to jump quickly onto something else, which is the benefits now that we are understanding from exercise in terms of what we call non-motor symptoms. And this includes a whole bunch of symptoms as well. And I just want to give you a quick example because we will have opportunity to dive deeper into each one of them throughout the year. This one is just an example of benefits over sleep, which is very curious to understand. If I measure if I slept well with using a device versus how I perceive, if I wake up in the morning and I perceive benefit, right? And so this, in terms of trying to see if exercise would benefit also, the differences between it being measured objectively or subjectively. I can share with you that I have people with Parkinson that sometimes tell me, I wake up in the night and I can't fall asleep again. So I decided to try out exercising. And I was like, most sleep specialists usually recommend we don't do exercise before going to bed, but we don't know enough about that. He says, you know what, but it actually helps me fall back asleep. So here what I'm highlighting, it's very important for us to hear these things in the clinical practice so that we can come back to the researchers and say, you know what, maybe we should try to study the effect of it, right?
And actually with the breath training, the expiratory muscle strength training, sometimes they recommend it near the bedtime as a way of strengthening people who are dealing with sleep apnea or something like that. So there are reasons to do it, but yeah, usually sleep hygiene would dictate the opposite.
Yeah. So let's see on fatigue. Now, this is also not a very intuitive one, right? Because you'd think, wait a minute, I'm tired and I'm going to do exercise if I'm already exhausted. And here is research that really shows that if we do physical exercise, it actually might improve fatigue. When we think about how about depression and anxiety, and if I'm depressed, it will make it very challenging for me to keep motivated to exercise. And sure enough, so exercise has been now shown to be able to improve both those symptoms. So we just have to find maybe the type of exercise that I'm going to prescribe for someone that is depressed and with anxiety will be maybe completely different for someone that I'm trying to focus on another goal. Keep that in mind because that will be a key message. And here, when we think about cognition, is another area where exercise is definitely coming in very strong, particularly like this paper as an example, because it's really diving in a different way. It's not like exercise in general. They're actually doing what? They are comparing 3 types of different exercises: aerobic exercise, coordination, resistance. And what they're looking into, okay, so how would which cognitive functions would they improve? So first of all, they showed that all these 3 types of exercise improve globally cognitive function. But if we do aerobic exercise, we might improve more memory and executive functioning, which is like planning and taking decisions. So this one guides us a little bit more like, wait a minute, if I'm dealing more with this, maybe I should focus more on doing more aerobic exercise. So hopefully I'm transmitting an idea where the transition now is, it's not just the overall exercise is beneficial, but maybe there are different types of exercises that may affect the symptoms also differently. And I think this is a very changing moment in terms of research at this moment. We were very fortunate to have this work come out recently last year. And I must tell you, so this type of effort requires a lot. And what you can see in this research paper, basically they grabbed onto 10 different exercise modalities, and they compared them to specific symptoms in Parkinson to see which of them would be, for example, when we think about severity of motor symptoms, this means those tests that the neurologist does with you when he asks you to open and close your hands and your finger tapping the finger. So it's a way for us to monitor progression. And so when we compare those, we see that the ones that best allow us to, in this group of people with Parkinson that was studied, remember, to control the progression of the disease was dance, aqua fitness, and gait imbalance and functional training. You see? So this is how, if it's more on the left, that means it has higher efficacy. If it's more on the right, it has lower for this specific symptom, right? Let me give you a more concrete one, which I think everyone is looking desperately for solutions for freezing of gait. And it was very interesting because the ones that really had the most efficacy was strength and resistance, and then aqua again, and dance. If we understand movement, we understand that all these 3 require a lot of global movements, and that you can probably see in the others, but it's probably the intensity is greater here. When we look at quality of life, so more general symptom, right? We want to improve just living well with Parkinson. And what we found, again, the one that highlights most, that had the largest effect, was aqua there. Now, I want to give you an example of what you see here in the video. If we are comparing a group to individual, we can imagine that we might intuitively say, well, if I work individually, I probably have better benefits. But again, let's go back to the rationale. If I have someone with depression, I might really want to suggest or recommend that probably in a small group, you will probably be able to get better results for the depression, for the apathy, because we have the socialization element stronger. That doesn't mean the therapist, if he's not cheerful, he will cheer you up as well. But if I wanted to get better results for mobility, then one-on-one will probably be recommended, which means there's still a lot of unanswered questions. We can't just grab onto one study and say, okay, guys, the best thing for freezing gait is this. It really has to come back to a rationale where we think about the person that's in front of us. And so we're going to leave you here with a list of questions in exercise that we still have to figure out. The example I was giving you earlier just now was regarding which type of exercise, when, how long, to who, is still key questions. How do we organize this? We need better results for the cognition and for the non-motor symptoms. As I said, it was still very light in terms of few studies. I think one that everyone is ultimately very interested is the potential influence it will have on the disease progression. It was your number one thing that I saw from the questionnaires, that people said, I do exercise so that I can control the progression of the disease. And then obviously knowing things like the difference between what type of exercise are we going to recommend for someone that is 45 versus someone that is 65, or someone that has 5 years of diagnosis or 10 years of diagnosis. So as you can see, and the one that's next, the pharmacological impact, I think that one's also very interesting. How does it help my medication be more effective or not. And yes, so and then obviously the role of technology, where we just can't stop using it. As you can see, that's why we're here today. So I think I did want to highlight that it was interesting. This was results from the questionnaires when we asked you what type of exercise programs.
Yeah, I mean, especially because it was so evenly matched between people who are doing in-person classes, some of the many that the Inova Parkinson and Mood Disorder Center is sponsoring versus the ones that are online, which are also sponsored by the IPNDC. And then some people talk about doing pre-recorded programs, or maybe something that was done like a home-based exercise routine. But again, at the very top, I see in-person and online.
Yeah. What I found interesting about this is I wouldn't expect this, because we know that people usually, especially the transition from COVID, right?
Yeah.
Where everyone know, I want to be in person, right? We were so fed up with technology, but we're not in that time. And so I found it interesting that it was more or less the same,
I feel like
which is a clear response, right?
yeah, COVID brought people to the table, but I think the classes that continue to do well are the ones that have done something compelling. I feel good about that. Not that in person isn't valuable for other reasons as well, but it's nice to have a mix. And with the weather the way it is this past couple of weeks, it's also nice to have options too. Right?
There's multiple reasons for that. Okay, so that was very brief research. As I say, we want to be very practical. So, and we will have time to go into deeper into each one of the studies. But let's focus on what problems we have, so that we can focus on the solutions after, right? So when we think about what about referrals, it's very interesting when I ask this, that people often tell me, why hasn't the doctor told me about exercise? Which this must be. I actually got this comment last year, which kind of shocks me, right? Because we all hear now a lot about exercise, but unfortunately, I have to share with you, it is more often than we think, that people still are not getting this information, and so we must really end it. But there's already this is a nice paper that was published. It's almost a message to the doctors, so that they could share the fact that patients expect exercise advice to come from health professionals, specifically the neurologist, the doctors, and a physiotherapist. It was a survey that was done, and I think just showing that and being able for the clinical and the professionals to read this is very important. So they feel the responsibility of doing this. And more, they went a little bit deeper, is that people with Parkinson who were never advised by their doctors to exercise were among the people with the highest proportion of non-exercises when we compare to people that exercise. So we see the importance of this role. And so we can tell you that the Movement Disorder Society, which is one of the most relevant in terms of medical education, is putting together an effort of a lot of papers, and namely this one, which will be a recommendation on what type of exercises for what type of situations. Now you can see it's, don't worry, you'll have access to the slides. So it's not a question of you reading. I just wanted to give you an idea that we want the doctors to be able to have a tool like this. And instead of just saying, yes, you should do exercise, it's just like, you know what, the person that's in front of me is dealing with this. So maybe I will give more emphasis to this, right? So it's,
kind of getting away from the old saw of the best exercises, whichever one you'll do, and getting towards something that's actually addressing your thing. That's great.
Yeah. So I think this was the guide. So I'm just sharing with you, this is a guide for more health professionals to understand that we have to think differently. And so when we think also at the instructors levels, which means who are the people that are applying this, we get many times that people tell us that they don't feel that the people they're working with really have expertise. I'm sure people I usually say, give them some information, help spread the knowledge. Because if for some reason someone you're working with has never had contact with Parkinson's disease, by having contact with you will already be enough for them to go look for information. And fortunately, there's a lot of information out there right now. So I think this is the area that would worry me less. But I do want to highlight that we know that people are in the community with different type of professionals. This was an effort to show that in the Netherlands, actually, that if you are accompanied by a specialized therapist, there will be lower costs. And this was a major important study to show less complications if you have access to a specialized therapist. And now I'm showing this because the rationale is, okay, if I'm working with someone in the exercise world, so exercise professional or whatever, it's the same rationale. If he has knowledge about Parkinson, he will identify crises quicker, among many other advantages. Very well. So we come to the one that is most my enthusiasm, my passion, and it's the solution. All the others were things that I covered in the PhD.
Yeah, they're relevant.
But this one is the one that I wanted to focus on. I didn't get a chance to do stronger. So which is, we feel, and by the surveys we can confirm this, that people are having a lot of difficulty now choosing from all the variety of programs. Would you all agree?
Information overload.
Us helping you understand, how can I take decisions among so many options? So there's probably a million more. I'm sure they're not all here. Just things, just some programs that are most commonly well known, which would be like the Lisa Beep program, which is very, very similar, and also with the power of Parkinson Wellness Recovery, the ping pong, PD Warriors. So you can see that these things, these type of programs are growing and they're spreading throughout the world. It's good. It's good to have options, right? It's good to have options, but then we have to understand how we can guide PT. This was from the results from your questionnaires. So trying to see in your community, what would people be more accessing, I would say, like that.
Yeah, and I mean, walking is obviously the easiest one, and everyone gets to that, and I think it's great, and it's very functional. As an SLP, obviously, I'm excited to see people talking about speech and communication, and a number of people doing online. Some of the branded approaches that I would expect, like the big or Parkinson's Wellness Recovery, not as much. The classes are out there, but I think that speaks to people wanting something targeting their actual needs.
And it might be the fact that maybe it's programs that are incorporated into rehabilitation more versus community exercise. Sometimes, and again, we saw that you might access one or the other differently. We do see pink dance is always very popular, as we saw, right? Yes. Okay. So just to share with you what people are doing, and this is important for us when we give examples, we know what you guys are doing, and so that we can focus on helping guide you in those directions.
So this person came in with a question or with a response, and they said, I'm confused why rock climbing and dancing and boxing are recommended. For this person, they're not interested in these activities and they're difficult to access on a regular basis. But then they go back to what they're doing. They're doing a fair amount of exercise. They're exercising 2 hours a day with walking, strength training with bands and small weights and body weight, balancing, core training, and stretching. But, there's the underlying concern. Is this sufficient to deter the disease? And, they have a long history of exercising, which means they probably have to exercise more like they have been. But what other exercises should they be doing? Should they be doing other exercises?
So we hope with this comment we can transmit what we were saying previously, which is we need to help people make decisions. We need to give you more information so you can make the best decision. Just like we gave the doctors that guide, that tool, this is my version of what I think should help you. So just very simple questions that people should always question when they're doing, when they start an exercise or what they're doing. Just thinking about, is whatever I'm doing effective for my goals? So if I want to improve my balance, is the exercise that I'm doing most effective for balance? Okay. And giving you an example of balance, but it can be anything. Then we have to think about safety. So this is usually the number one concern of the neurologist. Make sure that what you are doing is safe. We don't have enough data, and I'll come back to this topic soon. But we also have to weigh if we enjoy it, because motivation is key to ongoing exercise. And we know how we can have those good days that I said, and bad days. We can have depression. We can have crisis situations. So it's always an ongoing challenge to keep motivated. So enjoyment factor is very important. And then obviously believing that I can do it. So if someone tells you, you know what, you should go do boxing, and the person says, I really don't care for, or I don't think I can do it. just like the gentleman before is like, why are we talking about rock climbing? Why are we talking about boxing? Right? I think it's just the desperation of clinicians and uh, trying to give a menu of options so that we can keep people engaged in exercise, and then we are forgetting about all the rest. And then I wouldn't say, I think all these questions are important. If one of them fails, everything fails. And so this last one is not less important, which is it accessible? So we can recommend the best thing ever, but if it's not accessible, no one will use it. Now, this has summarized 3 key areas, which is actually the target of research, which is effectiveness, if it really does what it says is it's supposed to do, if it is safe, and obviously if people adhere to it. I just want to focus on safety for a minute. So if we think about, how do I know if it's safe, and how can therapists guide you with this? Now we have some challenges here, because in most research studies, we see, in this one actually reports this, that people don't usually report so much the adverse events. They might say minor things like a fall, muscle cramps, tiredness, knee pain during a dance program, muscle soreness. So it doesn't, how these adverse events happen, in what circumstances, would be very important for us clinicians to be able to keep you safer. So we are really failing at this part. It's always like it's almost like we only publish positive results. But I can give you the example of the one that we did of the kicking. We learned a lot from research studies that don't give us the results that we want.
I think the new open science initiatives are really moving towards that, and it helps us because if you have a publication that publishes the negative results or results that don't show any benefit, that's valuable, and it shows other clinicians about what doesn't work. If you just always publish only the good stuff, you're getting this weird biased output, and it's not realistic. So I think open science is coming, and I'm glad to see more of it out there, but time will tell.
Yeah. So one place that I like to go and see, because where people are very free to say whatever, which is Facebook, social media in general. I do like to follow and to see what people are saying regarding their exercise, and sometimes we get things like this. Why do people leave the programs? It's like the easy answer is injury. So we'd focus more on people getting hurt, feeling that they are continuously being hurt. So injuries would be the one, but I don't think it should be only about injuries. It's just about the frustration of not being able to do something, and which you can see in this last comment here. The person saying today was hard. It was really exacerbating my inabilities, right? No, the key sentence is, I left in tears today. I think, yeah, you know what? If we're doing exercise, and of course we can have bad days. It shouldn't happen more than once at least. Let's create a criteria. If it happens more than once, maybe you should reassess.
You shouldn't be feeling dismotivated. You should be having fun and feeling like you're making progress, and it keeps you wanting to come back, not, I got to kill today and I can't keep up.
Yeah, or at least talk to the instructors about it, because they might not be seeing. They can give you why something is happening. And then on your left is the from question is again, do you feel safe while exercising? And surprisingly, most said, so half of you said yes, always. But you can see that it's most of the time. So it's not as clear as we thought, right? It's not 100% yes, I always feel safe. What I tend to defend is safety really depends on the expertise. So you see how the emphasis I gave on the experts, on the instructors. If they recognize, if they know Parkinson, they will predict the movements and the risk situations. Even today, I was discussing with the person that I'm working with. He's doing boxing close to his home, and I'm very happy for him. And he was just showing me an exercise that he usually asks, you know what, why don't you show me the exercises that you do? And maybe we can do a video and I can send it to the instructor. So here I am trying to create a collaboration. And suddenly he's running laterally, and like the risks of running sideways. And I'm usually a child therapist. So believe me, when I was hearing that, I was like, oh my goodness, the risk is so is big. But anyway, let us, I just wanted to, the differences of safety obviously will depend. Am I talking about if I'm in an individual, there's no risks, right? Because obviously the person that's with you, if when we do exercise in a group, the therapist has to change what she does. So maybe I can train balance if I'm working with someone one-on-one. When I'm working in a group, it's very unrealistic for me to say that I can train balance safely, right? How about online? What can I do online? Um, and and so if I'm doing something online, an exercise class online, my goals are also different. In person, I can see the whole body. I can see how people react. I can adapt. Maybe online, I'm more limited. And so my goals maybe is more aerobic exercise, for example, in this case of the dance class that we usually give. So again, I just want you to transmit that we do adapt things accordingly. And now, so I don't worry a lot about that safety. How about all the factors that can interfere with your motivation to do exercise, to adhere to exercise? And it was nice to see this publicly recently. It is an area where there's a lot of research, yes, because we all trying to figure out what are the factors that stop you from exercising. And what we can see here is different things, so at different levels. And it was surprising to see that the biggest ones was actually program design. And I was actually commenting with John, is like, oh, that's nice to know because, those are, so the area that affects more, that has more impact on adherence is things of the programs, right? So, and that really says, that depends on what? Depends on your community, on your exercise profession, on your physiotherapist, on the scientific community, to make programs that are more engaging, the way we deliver. I can say those are things that we can more or less study and control. So I was actually happy to see this. And not so much as I hear often, transportation is a barrier, costs, location. And I would imagine that the worst one would be the fluctuation nature of Parkinson's disease, which means one day you might sleep bad and the fatigue or the pain is worse, or then maybe the medication didn't work so well, so you don't feel so well on that day, and that the disease brings those challenges continuously. But we do know that Parkinson progresses slowly, so if everything goes well, people can have very normal days. I do want to come to this point that we touched upon, which is commonly when people ask doctors, physiotherapists, which exercise is best, or any other, there's a tendency for us to hear this, which is do whatever exercise you like. And when we think about, okay, what are the unmet, I think this is definitely a point where we have to transition. Why? Because hopefully we have showed that there's so much research and detail that can go into how we think about exercise, that if we do as a community, as a society, decide that it is do whatever you like, then I think we should stop doing research. There's no point for us wasting money research if we don't apply it. So I tend to get quite agitated when I see this response, and I've seen it many different professionals. I understand what they're saying. When we say do whatever you like or do the exercises you like, is because we are so worried about motivation. We are so worried about the person adhering to exercise and being able to do anything, that obviously if I have someone that is highly depressed with apathy, I am not going to be complicating the person's life. I'm going to grab onto something that the person likes, and I'm going to try to help him get into the routine of the exercises. So I don't think one extreme that we have to choose, but I think we have to rethink about how we're transmitting to them, to the community in a time where people are actually exercising a lot. So from the questionnaires, I saw that only one person said they weren't exercising. And it could be for many reasons. Maybe they had some setback right now. I usually treat a lot of people that don't like to exercise, so I tend to brainstorm a lot about this.
It's a bit of a culture shock, but nice. It's funny.
Okay, so hopefully everyone's okay. We're going to come to a key question here. So which exercise should I do, right? And so if we asking the question, which is the best exercise, I tend to recommend that you add something to that sentence. And which is the best exercise for what? Define your what. Because just answering in general, I think we know more now. We can do more. And you will, when you hear talks about exercise, usually you will hear about the recommendations, exercise recommendations that exist, which is about doing 3 times a week aerobic exercise, doing balance 2 or 3 times a week, doing strength training, doing stretching, right? And these is what I call ingredients of exercise. And when we talk about the community programs, that means we are trying to find ways to create programs that will combine all these. And that's why at that time we thought, okay, how about adding kicking into the boxing, right? So because it was the element that was missing or that was not as strong. So hopefully this image helps you translate to why the reason why we are starting this program is so that we can guide you in these decisions. So we will throughout this year being specifically focusing on the best exercise that that the evidence and our experience as well for these topics, for walking, for communication, cognition, daily activities, for swallowing. So we're going to choose a specific issue and we're going to think and we're going to brainstorm about what would be the most relevant exercises for each one of them. Now you might ask, now why did we choose these? We chose these based on a questionnaire. Okay. Based on things that are concerning people in terms of exercise and that you would like to improve. So it's like, so we have like things specifically like for posture, for walking, for mobility, for cognition. If I'm really dealing with something, if I'm concerned about my cognition, what would make sense for me to improve that? I hope with this talk and showing you these different things and these questions, by no means frightens anyone, because I think it might be overload of information about different opinions that we want to leave you really with, the worst thing that you can do is do nothing. But if you are already motivated for exercise and you really want to dig a little deeper about how you can maybe control better the symptom specific thing that you are dealing with, we hope that this program will help you. So, and I will just stop sharing so we can look at the questions and discuss a little bit with you guys.
Please help us as you go with linking the what types of exercise yields which better outcomes.
So that's what we will, today was to introduce the program. And so you mentioned, like, if we're thinking about cognition, I'll give you an example. What type of exercises or have already had some evidence that improve cognition? And then we will give you examples for that in that talk. So I can give you an example, like dance, right? Dance is one of the ones that has been most studied. And sometimes it's, why do we have those options? First of all, it's accessible. People have access to it. So when we think about recommendations, we're thinking about all those factors. Is it accessible? Can we recommend it without frustrating people? There's this program that I'm doing for trampoline training, for balance, that I think has showed such beautiful results, but it's not accessible for everyone. So it's, I see someone could hear balance. Yes. So walking will definitely be one of the first ones, maybe next month, based on the results of the questionnaire. And obviously, because it's something that everyone is, most of the people are doing some sort of walking. So can we think about, what is walking? Could be walking indoors, outdoors? Is walking on the treadmill the same thing as walking outside? Is walking with someone the same thing as walking by myself? Is walking with Nordic walking sticks better? So those are the type of questions that we will go into in these type of talks.
Okay, I'm hoping to learn more about, as research, about how many hours I need to maintain or put off progression. This has been, I won't say a great white whale, because there's been pretty good efforts in this area. I looked at the Sparks study that came out from the University of Colorado and other people across the U.S. It was a multi-center study. And it was a dosage study on a treadmill where they're trying to figure out not just intensity, but also amount of time. The study out of Yale that came out last year is a small one, but they used neuroimaging, group of like 13 people, and they showed benefits that may finally get to a point of actually saying that this is neuroprotected, or it's actually not just slowing down the rate of progression, but maybe providing improvements. The problem with the data that we have now is that it's so highly variable. It's hard to get to a definitive answer, although I think we can all see the benefits. That's why I think instead of trying to do everything and maintain all these pieces here because you want to get this part here and there, that's why I think it's really valuable to have a real discussion about what the problem is and then have a PT that knows a thing or two about Parkinson's guide you toward the exercise that really gives you the best benefits for what the problem is. Yeah.
By moving, you're already fighting against the progression of the disease. This we know, right? So movement. So imagine you don't feel that you're not doing push-ups or exercising or running, but if you're getting out of the couch, that is linked to survival. Okay. And so I think just pushing yourself a little bit more goes in line with most of the research that's coming out, and where we base those recommendations of 3 times a week of aerobic exercise will eventually have results on outcomes that we know are linked to progression of the disease. So there is already some support on that. A lot of enthusiasm, and then you have those people that are less enthusiastic because they always say, the sample of the study was small. Sometimes getting 4 or 5 people together is already a challenge. So so it's, you might hear different things, but movement I think will be the key. If you compare someone, I usually tell when I'm trying to motivate someone, and I usually say, so okay, imagine you have 2 people with Parkinson in January. One spends the whole time on the couch and the other one exercises. The probability of, the one that is working out in December is not going to be the same, right? So I think it's good sense when we don't have strong evidence or too many opinions. Good sense is still a criteria for us to use.
I mean, getting back to one of your very first statements about 20 years ago, this presentation wasn't possible, or even 10 years ago, it said, we have been using good sense for a long time to inform clinical practice. And finally, the research is catching up, and that's great. Thank God for it. But it's still going to lead to a lot of decision making now until we finally get real definitive answers.
Yeah. And usually when we get answers, we get more questions.
No comment.
What someone else is saying that they were concerned about best exercise for mood. And I think when we have anything that comes into the, I would say, into the package of mood, which is depression, apathy as well, anxiety, there is where we are most flexible, because maybe yoga works for someone with anxiety, and it's actually where most of the research is going. But in clinical practice, I see a lot of people with anxiety that really prefer, for example, boxing, and that's where they get their frustration out. So what influences your mood can be very specific to what you like. And so in that case, I would definitely say grab onto something you like, and then once you are improving and you feel integrated and you feel that you have a little bit more that you are capable of making a little bit more change, and then you can have that discussion about, okay, let me look into it. But even the recommendations that we have with the evidence at this moment, it's not so applicable to everyone. That one I think is very personalized.
Yeah, and you get into some really interesting stuff, because I think yoga or meditation, or you can see Tai Chi, I can see a lot of that kind of having a mind-body effect on there. And then obviously anything aerobic, it's going to increase the neurochemicals that we want, the neurotransmitters. So it is a little bit of finding things that work and fit in your lane, but also having something where on one day maybe you're doing something kind of aerobic or boxing or whatever you like, and then something on another day that may be more focused on your mind-body connection, which should be the yoga side of that. I mean, variety is going to be important as well.
It's like choosing a day for your vegetables, right?
Yeah.
I'm going to eat my vegetables.
I ride a bicycle, I do Pilates, I lift weights, and I change it up, and obviously I keep up certain classes, and that is often very difficult. So it's like you do a lot of things, you don't do, just one thing and say, set it and forget it.
I think one of the things we don't talk a lot about is if you have some sort of injury, and then you used to doing a lot of exercises, right? I actually see someone on screen that does so many exercises. I had to show her schedule on a talk I was giving for doctors, because I was like, oh my goodness, look, we've got a new problem. It's too much.
Jeez, that's a calendar just for the exercises. It's just the right amount for you.
And it's amazing. So it was just like, wow, I'm coming from a time where people didn't do exercise at all, right? And now it's like, how do we guide people so the criteria when I look at that, and I asked the person obviously, and I said, "Do you feel that this is okay? Are you happy with this?" And that's important, right? Because sometimes I get the opposite where people say, "I just feel like I'm spending too much time in exercise. It's like I don't live," and in there it's being negative. But no, if it's a way for us to also socialize, I think it's an interesting way to pass time. But I was gonna compliments is like the problems we have a schedule, and then sometimes something, some sort of crisis. Imagine we get some sort of dental infection or something, and then it's enough for the medication not to work. You got 2-3 days where you feel really bad, and then you got to get back on the exercise wagon, and it's just like I think that is usually the challenge that I feel that people express most, and then feeling guilty because you're not doing the exercise, and then when you hear these talks about progression, you've got to do exercise, which is please keep in mind that Parkinson is a slow progressing disease. It's supposed to be slow. Okay, so it's even when people go on holidays, sometimes they feel fearful because they're not gonna do their exercise routines. People are so happy when they go on holidays. The happiness, they walk more, they do more. So if it's a good holiday, usually it involves walking more. So it's like I think it's important for us at this moment as health professionals to help you understand, to not create more fear.
Someone said they would like a simple spreadsheet that shows which exercise provides which type of benefits. I think some of that's in the slides, but
Mm.
that wellness task force that you were talking about from the NDS, she's on that, and I know that's coming. So when that comes out, that will be the definitive one, I think.
Yes, and that serves a guide as again for the doctors to be able to refer a little bit more, and for the therapist.
So I hurt my non-dominant hand when at a rock climbing class, and there was a well reaction for some of the people in the room, but it took some time to heal, and it hurt. And there are some unique benefits, obviously, from that program, but it takes some guidance, and I think
Yeah. Well, I must say I do try to talk about exercise programs that I apply. So I am applying the rock climbing at this moment. As they come out, I want to understand it, and so usually it's like my hobby to do different types of exercises. And yes, I totally agree with you. I don't think we know enough. This goes in line with what I said, which is underreporting of adverse events. And because we don't hear these testimonies often, we are unable to grow safety measures, right?
there are two
And
good studies on it, and we're not
obviously,
getting into this with those studies, right?
yes. So it's like trying to understand how did that happen? Was it the hand that slipped? Um, Was it the timing? Was it the second time the person was going up? Do you see? There's lots of details that I would explore with this person to understand if it was a question of fatigue that interfered with the grasping. I thought that was what happened, right?
And I said it was a non-dominant hand, and it happened during it, but then actually talked about the grasping. Could also be a medication timing. It'd be making things more difficult, you know?
I know of some people that sometimes or climb like for example in my program, I tend to recommend people to go up and come down the same way.
Yeah.
Me personally, by the experience I'm having, the jumping off the rope is something that I wouldn't tell anyone to
The
do.
repelling or whatever, yeah.
But I do have young onset. It's people that are 42 years old, 45, and they say, "No, but I want to jump." And so this is where I feel the pleasure. And again, people are adults; they take decisions. And in that case, obviously, I don't want to be the cruel witch that takes away the fun. But I do say, to my best expertise, this is how I would probably apply it.
She's gotta really keep those little young whippersnappers, those 40-year-olds in line.
It's interesting to see the comparison, right? People want to be pushed, but then unfortunately we don't talk much enough about these injuries. That will be in the next.
This is also helpful for, again, when you're working with an provider in an exercise, whether it's something directed directly to Parkinson's or a community
Mm.
class, their expertise is gonna be very important. What do they know, what a problem looks like, what a fatigue situation looks like, what a medication timing looks like, well, all these things, and
Yeah.
good questions to ask, and also why I like to kinda
Mm.
keep pointing people towards IPMDC because they're keeping track of good people.
So someone that's putting fatigue, can movement help? Yes.
Big guy.
When we approach these talks, imagine we're doing a talk about best exercise for fatigue. We will not dive immediately onto exercise. We must think about what are the things that can be causing fatigue. So if you are dealing with this issue, we have to understand the relations that it has with the medication, right? So exercise has a role in these symptoms. That's true. But first, we must capacitate people to understand: are we fighting against adverse events of medication? Do you see? That wouldn't be.
Sleep issues.
They will win, right? They will win, unfortunately. So we hope to guide you a little bit about the questions that would be important for us to understand. Um, Definitely, the evidence that we have for movement is one. So exercise. What type? Imagine if you do exercise and you become very fatigued. How you feel after exercise is an important criteria for you to use. If you work out for an hour and then you feel so tired that the rest of the afternoon you are spending in a sofa or sleeping or recovering, something is wrong, right? Because it's, first of all, it's stealing life, right? It's your quality of life is being compromised with that. And then you wait a minute, but I've heard that I need to do vigorous exercise so that I can fight against the progression of disease. Again, it's that fear factor that I was saying. It's like, yes, vigorous can mean sitting and standing 12 times for someone, right? So depending on the physical capacity of that person, vigorous exercise can have different meanings. And when we do research, we grab onto things that are easy to research. So treadmill is easy. Bicycle is even easier. And that's why those modalities are studied. But in real life, we have to adapt to what makes that person tired. Exercise is supposed to invigorate you, and you should be feeling good. That means you can go through moments where you feel more tired, but at the end of the session, you should be able to recover. And if you feel tired after, okay, that's okay, reasonable. More than an hour is usually considered negative. That means the dosage was just too much.
Yeah, there should always be a net benefit. You're working, you're exercising, you're giving yourself a workout, but the net benefit over the course of a week shouldn't have you having to recover more than.
Yeah. So when we think about fatigue, it's like, okay, what type of movement would allow this person to not feel so fatigued? For example, if the medication sometimes is not working so well with someone, I might say, why don't we walk? I usually call it walk it off. So the person is becoming more stiff. Basically, the anxiety of the exercise is creating more rigidity, and I need to find quickly a way to distract the brain from that stress. And so walking is usually something that people find as a good way to do that. But for other people, might be, let's sit down. Let's talk about something else, right? So sometimes it's just finding ways to be able to distract the mind from that fatigue.
Have a good night.
See you soon.